This is Carrie Wachter with Global Medical News Network, reporting from the 2010 Breast Cancer Symposium in National Harbor, Maryland. The meeting was sponsored by the American Society for Clinical Oncology.
I think the real take-home message from the Breast Cancer Symposium is that breast cancer as a disease has changed. It's very different today than it was in the 1940s, 1950s, 1960s. It is almost a different illness, a chronic illness. And I don't think women have to be as afraid of the illness as they were before, because our collaborative approach to breast cancer care has dramatically improved outcome. We highlighted a study of women who were diagnosed and treated with breast cancer at MD Anderson, and in the 1940s and 1950s, from all stages of breast cancer, only 1 of 4 women lived 10 years. Today, 3 of 4 women live 10 years with the disease. When women are diagnosed with advanced breast cancer, meaning it's spread to other organs, in the 1940s, only 3% lived 10 years, and today that's 22%. So I think what's happened is breast cancer as a disease has changed because of the collaborative approach from medical oncologists using better drugs, radiation oncologists, translational science, and surgical oncologists. Women tend to remember breast cancer from the 1950s and 1960s, and it is a different illness, treated differently. I think another good example of that was a national trial looking at giving medications prior to surgery to women who were only appropriate for mastectomy. Women with larger breast cancers may need to undergo mastectomy instead of lumpectomy. And we know that ER-positive breast cancers respond to lowering of estrogen in the body. So what they did was they gave them aromatase inhibitors, which lower estrogen levels, and they found that 50% of women who were only appropriate for mastectomy could undergo lumpectomy after 16 weeks of these medications. So that treatment, which has morbidity, which is invasive, can be spared from 50% of our patients because of these medications. And when we think about breast cancer in the 1950s and 1960s, we only had mastectomy. Now we have lumpectomy, and now we can take patients who are thought to be only appropriate for mastectomy and give them this breast-conserving surgery.
This is Carrie Wachter reporting for Global Medical News Network.